Welcome to this segment of the Texas Nurses Association program on incident mitigation. My name is Danita Alfred, and my background in disaster nursing began during the 2005 Gulf Coast hurricanes. I primarily worked with shelters for displaced medically fragile survivors of Hurricanes Katrina and Rita. In this final segment, we will focus on the post-incident phase of a disaster, and we will cover the impact of stress and the role of resilience. I believe that many of us became nurses because of our desire to serve others. However, service can drain our resources, and we must take the time to restore those resources and build for the next time that we are called to serve. If you served during a recent disaster, it's really important to determine your level of distress. Anyone can develop PTSD. This includes emergency personnel, rescue workers, and nurses. PTSD, post-traumatic stress disorder, is characterized by prolonged distress following an event or experience that is shocking, scary, dangerous, or personally traumatic. PTSD typically interferes with the ability to rest, carry on normal relationships and/or work, and it can be acute or chronic. In PTSD, the symptoms do not abate as quickly as other stressors. They generally last a month or longer. Those symptoms include flashbacks or reliving a situation, nightmares or difficulty falling or staying asleep, purposefully avoiding thinking about or talking about the traumatic event, being easily startled or frightened, or withdrawal from friends, family, or normal activities. These symptoms can also be a normal response to trauma. However, with PTSD, the symptoms interfere with our daily activities and relationships, and they do not abate after a month or two. If you think you or a loved one may be suffering from PTSD, please seek professional help now. There are many formal and informal resources available to help with diagnosis and treatment of PTSD. Local resources, of course, include primary care providers, mental health providers, and often support groups are available. The Veterans Administration is actually a leader in the production of materials for use in diagnosis, treatment, and living with PTSD. I've included links to 2 pages from their website that are particularly pertinent to our discussion in post-disaster mitigation. The first page is information dedicated to crisis intervention for persons with PTSD or their families. The National Center for PTSD provides guidance related to where you can get help, and it includes a suicide prevention hotline number and resources for finding a therapist for the patient or for their family. The second page has self-help and coping tools. It includes information about a PTSD online coaching tool to help manage stress and a PTSD mobile app that can be downloaded. All of these tools are available to the user at no cost. You may be thinking, well, I don't have classic symptoms of PTSD, but I just don't feel like myself. The remainder of this presentation is for those of you experiencing stress that is not as severe as PTSD. You may be suffering from compassion fatigue, secondary post-traumatic stress, or acute stress following a difficult situation. We'll start off with the definition of acute stress. Acute stress occurs in response to specific events. Some professionals recommend participation in critical incident stress debriefing that is led by a skilled counselor. If CISD, critical incident stress debriefing, is not acceptable or available, talking to a colleague about the event can serve as an effective alternative. It's important to talk to a trusted friend or colleague. Talking about the event and what you encountered in a safe setting allows you to begin processing and regaining your balance. We're all vulnerable to stress. Our responses to traumatic events are similar to our responses to other life events. We are likely to suffer less dire consequences if we are less vulnerable. It might be good for you to examine your overall vulnerability to stress. If your vulnerability is low, you have more resources to put toward dealing with the stress. Stress is cumulative, and as vulnerability increases, so do those unwanted consequences. There's a link at the bottom of the page called How Vulnerable Are You to Stress? Score your overall vulnerability to see where you stand. You can also use the scale to see things that you can do to decrease your overall vulnerability. For example, are you getting 7 to 8 hours of sleep at least 4 nights a week? If not, you can begin to adjust your routine to increase your sleep. Unlike acute stress, compassion fatigue is insidious and it builds up over time. Compassion fatigue was first mentioned in the literature by a nurse, Carla Joynson. She defined it as the depletion of personal resources, physical, emotional, and spiritual, that's associated with caring for patients with traumatic injuries and serious illnesses. Just like we teach patients about recommended screenings such as mammograms or colonoscopies, early detection most often leads to cure. As a nurse, we need to recognize symptoms of compassion fatigue and attempt to address the fatigue proactively. The best course of action is prevention or early detection. There are tools to help you determine if you have compassion fatigue and how severe it is. Some key symptoms or indicators of compassion fatigue include feeling weak, tired, and run down as a result of working as a helper, feeling depressed as a result of working as a helper, being unsuccessful at separating work from personal life, feeling little compassion towards coworkers, thoughts that you are not succeeding at achieving life goals, and feeling like you're working more for money than personal fulfillment, having a sense of worthlessness, disillusionment, or resentment associated with work. Any of the above feelings can be a result of compassion fatigue. How many symptoms of compassion fatigue do you have? Cook Children's Hospital produced a compassion fatigue workbook for professionals. They have allowed us to share this great workbook with you, and we hope you find it a good resource for helping you renew your passion for nursing. The workbook is included in the study materials that accompany this program. How else can you help yourself and those you love after a disaster or a traumatic event? The Veterans Administration deals with the most serious forms of post-combat traumatic stress, and much of the literature on PTSD was generated by and for veterans and their families. The VA produced a wonderful family-focused program for disaster responders called Psychological First Aid Field Operations Guide. Use the link on the slide to review the complete program. Additional resources provided by the VA include the Psychological First Aid Manual and an app that provide responders with PFA guidelines and mentoring tips for use in the field. It's available for Apple and Android devices. The manual includes handouts for disaster and/or crisis survivors, how to connect with others by seeking social support, understanding what you or others may experience, finding tips to help with relaxation, avoid substance abuse, post-disaster or trauma, and help friends and family, including infants and toddlers, preschool-aged children, school-aged children, adolescents, and other adults adjust after disasters. Finally, we need to talk about resilience. Resilience is one of the most effective antidotes to stress and fatigue. Some of us are more resilient than others. However, even those who are resilient are not immune to stress and fatigue. The difference is those who are more resilient are able to bounce back faster and with less suffering. Some people are naturally resilient either due to skills learned in early life or personality traits that make them less vulnerable to the ill effects of stress and fatigue. However, everyone can learn to be more resilient. What are some of the characteristics of people who are the most resilient? They have strong relationships with non-judgmental people who allow them to talk about difficult subjects. They take care of their mind and body through healthy diets, exercise, and rest, and they know their limits. They have firm boundaries and understand what they actually have control over or influence on, and they recognize what is out of their control and where their limits are. Robert Termina, a proponent of positive psychology, proposed a multidimensional theory of adult personal resilience. It's based on 4 characteristics: determination, endurance, adaptability, and recuperability. I found a lot of great information in this easy-to-read article, and it's linked here and available online. To close our time, I've included a podcast that provides some practical guidance for building personal resilience. I hope you enjoy and find the discussion of VUCA world enlightening and fun. Our world at home is often volatile, uncertain, chaotic, and ambiguous. Using the 5 steps recommended in the podcast can help us build our resilience. Building resilience, addressing compassion fatigue before it progresses, and even recovering from post-traumatic stress take time, energy, and a commitment to helping ourselves and others to be strong and caring professionals that we committed to be when we became a nurse. We hope you found these presentations informational and feel prepared to keep your family safe while working during a disaster and upon return to your home, family, and work after a disaster event. Please visit www.texasnurses.org/C4C for more resources and information. And do not forget to explore the links and resources included in this presentation. Thank you for your time with us.